Hello, I'm Dr. Pavan Yadav. I'm working as Consultant Pulmonologist at Aster RV Hospital, Nagar, Bangalore. So, regarding interstitial lung disease or ILD, since it's being an uncommon disease, we get a lot of queries and people have a lot of doubts regarding this condition. And I would like to address a few of those questions and see as to how exactly we deal with this condition. So, ILD is a scarring process in the lungs. For example, if somebody burns the skin, when the healing happens, there's a scar tissue which is left. Similarly, if there is any inflammation which is happening in the lungs, it can lead to a fibrosis or a scarring process inside the lung also. So what exactly is the reason for this? There are multiple reasons which can lead to ultimately the scarring process or the fibrosis inside the lungs. So starting from somebody who may be chronically exposed to dust or smoke at his workplace or occupational exposure can lead to fibrosis in the lungs over a period of time. Second is somebody who has been exposed to, let's say, pigeon droppings or any organic dust, chronic exposure, it can lead to scarring and fibrosis in the lungs. The third component would be something called as autoimmune condition, wherein there are certain antibodies which are produced in the body against the body's own cells. You must have heard about conditions like rheumatoid arthritis, SLE, etc. So all these conditions can also have associated fibrosis in the lungs, which is interstitial lung disease secondary to connective tissue disorders. And the last component is where we don't know exactly as to what is the cause for this fibrosis, but we know for sure the fibrosis is there, because of which the patient is symptomatic, and unfortunately this fibrosis is gradually and progressively continues to progress, so that the patient continues to be symptomatic and continues to get worse, and ultimately leads to patient becoming oxygen dependent. So the importance here is to identify this interstitial lung disease and to make an appropriate diagnosis of the type of interstitial lung disease so that it can be dealt with in an appropriate way. Most important is how to diagnose the interstitial lung disease. The most important modality here is CT scan. Patients usually have symptoms like chronic cough, which is usually dry, exertional breathlessness, that is when the patient is trying to exert or walk a certain distance, or they are trying to climb steps, they become more and more breathless, and this breathlessness continues to progress. In such a condition, after doing an extensive physical examination, a pulmonologist would ask for a CT scan, and CT scan is the definitive modality in picking up this diagnosis of interstitial lung disease. So interstitial lung disease is again a wide spectrum. At one end of this spectrum, we have something called a cellular interstitial lung disease, which responds very well to steroids and other immunomodulatory agents. And other end of the spectrum is purely fibrotic ILDs, which usually doesn't respond to the anti-inflammatory agents, and for which we have to use medications to to halt the progression of this fibrosis. The importance here is we have to make an appropriate diagnosis, and if we are not very sure as to what is the cause, and the patient may require a biopsy of the lungs, of the fibrotic area inside the lungs, to give an appropriate diagnosis. So in the Aster years, the biopsies used to be by surgical modality. Nowadays we do biopsies with the help of the bronchoscopy itself, which is a minimally invasive procedure, which gives us the diagnosis within 48 hours. And once the diagnosis is made, we can initiate the treatment, and the patient has to be kept under regular and prolonged follow-up to see how the patient behaves. And with the availability of the lung transplantation in this country and as well as across the world, so appropriate diagnosis helps us to prepare for this modality of treatment in the form of lung transplantation as well in patients who are not responding to the standard modality of treatment and when the disease continues to progress.